This month, two of the nation's largest pharmacy chains will begin selling the abortion pill Mifepristone in their stores. CBS and Walgreens say that they have been FDA certified to dispense the medication to patients with prescriptions in states where it is legal. However, the pharmacy chains noted that they will not be providing the pill via mail. Lee Hasselbacher joins us now. She is a research assistant professor and faculty director of CI3, a research center at the University of Chicago. Thank you for being here. So tell us, how big of a change is this?
Yeah, thanks for having me. As you mentioned, mifepristone has been a highly regulated drug by the FDA since it was approved in 2000. And in the past, it was required to be given to a patient by their provider in person. But decades of research on the safety of mifepristone has prompted the FDA in recent years to update their regulations and allow mifepristone to be mailed to patients or for certified pharmacies now to fill prescriptions. During the COVID-19 pandemic, some providers began working with mail order pharmacies to dispense mifepristone to their patients. But this announcement from CVS and Walgreens will
Walgreens
really
and
be the first
CVS will
time
be
someone
selling a
can
popular.
walk into a retail storefront pharmacy and fill a prescription for mifepristone.
Well, there's obviously a lot of misinformation about abortion pills. Lee, you just mentioned it was prompted by the safety review to allow for this change. Talk to our viewers about how long mifepristone's been in use and what are any of those safety concerns.
Yeah, mifepristone, as I mentioned, has been approved since 2000 by the FDA. And just a little context, so mifepristone and misoprostol are the two medications that are commonly used in a medication abortion. Misoprostol is already widely available in pharmacies and prescribed for a range of conditions, including miscarriage management and abortion. And it's also important to note that mifepristone and misoprostol in combination have been used to treat miscarriage in the past, and that misoprostol alone is also available for for providing medication abortion. So really, there's been a long history of research on the safety of mifepristone. A review of studies found, 99% of patients have no serious complications.
I want to talk about President Biden. He said that this approval for CVS and Walgreens is a milestone. He encouraged other pharmacies to follow suit. How hard is this going to be for independent pharmacies?
There's certainly some procedural requests of the pharmacies that want to seek certification. There has to be an agreement form. You have to have certified prescribers, and you have to have some, paperwork that shows that you have the agreements with these prescribers. But really, it's just some paperwork. And as our research has shown at U Chicago, where we talk to pharmacists around the country about their willingness and readiness to dispense mifepristone should these FDA regulations allow, and really, pharmacists, they already are very comfortable with misoprostol. They said they would
Mhm.
just need a little bit of training to get caught up on mifepristone, but otherwise they feel very ready to dispense this medication.
Well, the backdrop is, of course, the larger abortion debate, the ongoing legal battle over mifepristone, and approval on that drug. That's being challenged. The Supreme Court's expected to hear that case later this month. So talk to us about, I guess, put it into context with that challenge being brought all the way up to the highest court in the land.
Yeah, definitely. There's a lot of considerations right now. And, as you said, this case is going to be heard before the Supreme Court later this month. And really, what the court is going to be considering is whether they entirely remove the approval that the FDA granted for mifepristone, which seems less likely. But they're really considering whether to roll back these recent regulations such that mifepristone would no longer be available in a certified pharmacy setting, for example. So what that would mean is that patients would have to go back to seeing their providers in person in the clinic. Clinicians would have to stock mifepristone in the clinics if they wanted to provide that care. So we've also done some other research at our institution with folks who work in primary care settings or community health center settings who said they would be really, potentially interested in providing their patients with early abortion or early management of miscarriage care in their office settings if they could write a prescription that could be filled at the pharmacy. But a lot of that would be in jeopardy if, this case went forward and those FDA regulations were rolled back, such that you would have to, go through the sort of logistical challenges of stocking the drug in your clinic.
All right, Lee Hasselbacher, thank you.
Yeah, thank you.